Hooray! So, thank you all so much for coming. Hi, I'm Dr. Paul. The way you say my last name is Theriault. It's like Ontario. I have a very French last name, but I never really learned French, so that's just how life goes sometimes. Yeah, thank you. I know, we all understand it. I go see my relatives in the Maritimes, and they're twittering away at French at me in the airport, and I'm like, je ne parle pas français. And like, well, I don't speak, oh, you should speak French. Canada is a bilingual country. And like, no, New Brunswick's bilingual, and Montreal is bilingual, and Ottawa is bilingual, and I just never learned it in Calgary. So, I'm a naturopathic doctor. I graduated from the Canadian College of Naturopathic Medicine, or CCNM, in 2010 in Toronto. And I did my undergraduate degree in biology and cultural anthropology, which you'll kind of see come into my presentation a little bit. I have quite a wide-ranging practice. I do a lot of mental, so I practice just in South Calgary. Increasingly I'm treating musculoskeletal pain these days with acupuncture and with some other methods that I do. I'm starting an increasing practice in naturopathic aesthetics, which we'll get into a little bit. Do a lot of work with digestion and hormones, and yeah, mental emotional health is really the big thing that I'm like super amazingly good at treating. Everything else I'm quite good at, but that's like, yay, this is my specialty. So we're here to do a presentation today about women's health. It's really fascinating that a gay guy is coming in and talking to you all about women's health, but I do know quite a bit about this. Women's hormones and women's health is a fascinating topic, and one that I'm very fond of. So, and something about a gay guy talking to women about their various hormonal and girl parts things just seems to really go a lot better. So, it's very funny. I've had many conversations, being quite frank, with people discussing birth control methods and so forth. And I'm just like, okay, you can do this, you can do the ring, you can do the IUD, you can do pills. These are the consequences of the pills, and so forth. And the person and the patient is like, oh my God, Paul, I've never had this kind of talk with like a male of any kind or a healthcare provider, let alone an ND. And I'm like, yeah, that's kind of, So that's kind of, I suppose, how I got into that is just, it's not really difficult for me to talk about these things. So anyway. Complex topic. Do you all have any specific things you would like to learn about? Because I've got this big long presentation, but if there's things I haven't, but women's health is a complex topic. I can't cover all of it in 2 hours. So if there's things you guys want me to emphasize, please do speak up. Hormones. Yes, we're going to do hormones in great detail.
Hormones.
Did you have one? No.
I guess I'm wondering if you'd be touching on hormones and how they get triggered, or
yeah.
like a menstrual cycle?
We'll be doing that. Yeah.
Okay.
After childbirth.
No, that's
Yeah.
what
After childbirth. All right.
Why can't you go from normal to raging maniac in about 4 or 5 seconds?
So there's a condition I like to hold on.
I have that issue.
So there's 2 conditions I'd like to get added to the Merck manual. So the Merck manual is the big manual of diseases and so forth, and one is MFH and one is no, they're both MFH. One is menopause from hell, and the other is menstruation from hell. Those are both, so those are both conditions I would like to see added. I don't think they're going to do that. But yeah, so we'll get into those things. So, got hormones? Anything else? All right, well, if anything does occur to you, just please do ask. All right? So, historically, women were really actually very strongly neglected within medicine. If any of you came to my kind of men's health presentation I did last month, and now it's online, men's health women were always kind of seen as derivatives of men, but inferior derivatives. The men they back in classical medicine of most kinds, not holistic medicine, but classical, the precursors to conventional medicine. They saw humans as humans, but humans were really men, and women were just considered an inferior derivative of men. There's also quite a few religious connotations to this treatment as well. In the West, there was this idea that women in menstrual pain and childbirth pain and so forth were divinely ordained. For I'm sure you all can figure out the reasons why. There was this idea that Eve was, Eve sinned, Eve doomed the human race, therefore all women have to suffer forever about that. And so things like relieving menstrual tension, and menstrual issues, balancing hormones, or whatever the equivalent they did at the time was, and even things as simple as anesthetics for childbirth were very strongly frowned upon. Wasn't really like they'd known about various drugs that relieved pain for a long time. It wasn't really until Queen Victoria took one that it became okay, because Queen Victoria was the queen and nobody told her otherwise. So that's when ether, or the use of anesthetics in childbirth, really became accepted. And the whole idea of it's okay to relieve pain, and pain and suffering are not something that are worthwhile, that's kind of when that came in. So that's just a little bit. I really like medical history, so that's actually quite a fascinating bit for me. This didn't really actually change that. It changed a little bit during the first wave feminism movement. So first wave feminism is like suffragettes. Like you remember in Mary Poppins, the mom who was chaining herself to the prime minister's carriage and so forth. Like that wave, there was a wave of female doctors that got trained and began actually specifically paying attention to women's health problems. A great deal of them were actually homeopathic doctors. Very few people know this, but I think the first medical schools started training, or the first conventional medical schools started training women about 30 or 40 years after the first homeopathic medical schools. So and all of the major suffragettes, like Susan B. Anthony and so forth, all were either homeopathic patients, and some of them were actually practitioners themselves. They used it on their own families and so forth. So, but that kind of died out during the interwar period and right after World War II. Women's health as a movement, as we know it nowadays, really got founded with second wave feminism in the 70s. All of a sudden, it became widely apparent that this view of humans as well, the view of health as deriving from men's health issues, or the generic male body, and women being an inferior derivative of that was kind of silly. It was so things like the fact that hormones influence women's behavior, and that that this is not just something inherent to women. This is actually can be pathological and can be corrected. The idea that people need pelvic exams and pap smears and things like that. The whole movement of gynecology was a bit older, but the idea that gynecology shouldn't be painful and stressful, that gynecology should actually be health promoting and life affirming, and the non-medicalization of birth, which is still ongoing. It was only a few years ago that Alberta regulated and kind of incorporated into the medical system midwifery. So midwifery, the whole movement of midwifery is having really well-trained people who know how to manage birth complications, but know how to have a birth proceed in a way that's not traumatic and it's not overly medicalized. Birth is a natural process. Your body knows how to do it. There are times when medical and surgical intervention is necessary, but a large proportion of the time it can proceed fairly well, especially with good preparation of the woman and good preconception care and so forth. So this is still not perfect. I mean, unless you're booking a pregnancy 2 or 3 years in advance, good luck trying to find a midwife in Alberta. But there has been quite a big improvement since then. With the exception of midwifery, a lot and holistic health, however, much of this improvement has gone on within what I call an allopathic model. So remember how I told you guys that I studied cultural anthropology? So one of the big things with anthropology is figuring out how people's minds work around certain topics. In much of the Western world, we have this idea that there's the right way of doing things, and then everything else is just ridiculous. Anthropologically, that's just stupid. There are multiple different ways of kind of organizing your ideas around certain topics, and one of them, I'll refer to it either as conventional. I don't really like that word, but everyone knows what it means. So conventional medicine or allopathic medicine. And allopathic medicine kind of describes the philosophy of the conventional branch of medicine. So much of this growth in women's health has occurred within that conventional branch of medicine. Understandably, it is the vast majority of medical practitioners. Holistic care still is quite marginalized. The body, and one of the big things with this model of health and illness is that the body is looked at as a machine. It has a very mechanistic view of it, rather than seeing the body as a system that regulates itself, and that simply loses that ability to regulate itself effectively due to various factors. And as well, this is one that we're all quite familiar with. Having this women's health growth over the last 30 or 40 years occur within conventional medicine makes us deal with the problem of institutionalized medicine in the first place. We've all had problems with hospitals running and the transition between different branches within a hospital and various branches within AHS and so forth. Those are all outgrowths, not so much of well, they're partially outgrowths of medical philosophy, but they're also outgrowths of just institutionalization of medicine to a certain extent. And the healing ability of the body itself is largely neglected. So that is what naturopathic medicine is amazingly good at. Naturopaths are the masters of getting the body to return to its own state of health, getting the body to return to its own state of balance. The body is quite capable of doing this. We just need to figure out what's wrong with the body or what's stopping the body from going back to that state, and sometimes you need to give a little bit of a kick in the butt to do that. So we'll be discussing that over a number of topics today. So in addition to that, there have been some really, really interesting things happening that have impacted women's health greatly. Some of them we're all quite aware of. Mass hormone replacement. I'm recording this, so and a bit of an aside, if anyone doesn't want their voice to be used, I'm recording this and I'm going to put this on YouTube, so none of you will be identified other than, I'm talking to AER. If anyone doesn't want their voice used, just tell me in advance and I'll turn it off for a second. So yeah, but because I'm recording myself, I'm not going to use brand names, but we all remember this very popular brand of hormone replacement that was found to be it was given to women in menopause because it was assumed that the problems of menopause were an estrogen deficiency. So we started giving people a kind of estrogen that's from horses. And it turned out that was a really terrible idea. That caused a great deal of cancer and heart disease and stroke and so forth. One of the big public interventions that's happened with women's health for a while is this idea of mass milk consumption, that there was a big problem with calcium deficiency in women. It was leading to things like osteoporosis, and that the solution to that was to increase calcium consumption, and specifically the dairy lobby seized on that and started having all these ads about increasing milk consumption and so forth. Turns out that actually kind of makes osteoporosis worse. So that was kind of an interesting. That was a paper that was just published recently. The mass use of birth control, and I should have put I put birth control on the slide. I should have put hormonal birth control. That has had really profound impacts on just women's health and so forth. And mass mammography, which is another interesting public health intervention, and we're going to get into that. And yeah, that's not going to be a happy one. That was quite a big fiasco. So, on the happier note, in addition to the increase of consciousness about women's health issues, there's been, over the last, since the 70s and 60s really, this growth in the holistic health movement. The medical care there is based on supporting your body's own innate healing abilities and augmenting them where they need to. It's been a struggle to establish a profession of competent, fully capable people who can do this. Much of the holistic medical movement has been a lay medical movement, people taking over their own care, the care of their friends and family members. There always have been professionals doing this, but they've been very small in number and still are, relatively speaking. Nowadays, that's why I always wanted to do something like this. So it was really quite difficult to find a profession that was capable of taking care of people and handling medical problems competently until I found naturopathic medicine. So that's kind of how I got into this. It also, the holistic women's health movement has also supported birth, which is non-pathologized, as I discussed earlier. Supportive and affirming psychological care, kind of getting out of the Freudian psychoanalytic pathological model, where things are described as pathologies and so forth and medicated away. You find still a lot of that in conventional psychiatric care. Affirming care throughout life that supports the body throughout the aging process and maintains function and health as long as possible, and true preventative medicine. There's a big thing within most like Medicare within Canada about preventative medicine these days. And preventative medicine is always diagnosing disease earlier. That's not preventative medicine, that's early diagnosis. I consider those two things very different. Preventative medicine is medical care that stops the disease from ever developing. Not screens for the disease and treats it early, stops it. That is kind of a big and very useful part of this movement. So these are some of the issues. As I don't know if I'm going to get through all of them, because a lot of things can go wrong in a way that is specifically impacted in women's bodies. I will try my darndest, and I don't think I covered all of them. If any of you have any questions, you can either come and talk to me or email me or anything, and I will be available. You know, I'm always available to you guys to answer your questions and so forth. So I will try my darndest to get through all of these, and we can see like this is quite a big list already. So I apologize for that, but time limitations. So let's get started. Hormonal issues. So this is the one that I think most of you kind of came here to learn about. There are a lot of problems with hormones. PMS, PMS, specific problems with menstrual flow, which I differentiate from PMS. Acne, difficulty conceiving. Hormonal dysregulation, which I put OCP, so OCP is the oral contraceptive pill. It also stems from quite a lot of environmental exposures to what we call exogenous estrogens, or estrogens that are coming from outside of your body. And the last one is polycystic ovarian syndrome. So again, I apologize, we could have done a ton more on this. I could speak for days on this one topic, but this is a general overview type talk.
I think you're, again, in such a wonderful place to do it because you're coming at it both from a very practical sense of what's going on.
I don't know why it's doing this.
But you're also looking at it.
I don't know why that happened. Okay, apparently I put a thing on this and I don't think I did that. So, my apologies about that.
Thank you.
Okay. I think I might have accidentally put a soundtrack to that. That was one of my teachers. That was one of my teachers lecturing. So, have any of you gone to my talks before? Hands up. So a couple of you. Those of you who have kind of remember, I go over this almost every time. This is the hormonal triangle of misery. Yeah, no, because it makes everyone miserable. So, there are 3 hormonal systems on here. Each one of these interacts with each other in some very, very profound ways. Got up here the thyroid. So thyroid is this gland right here. The adrenal glands. And the ovaries. In the middle here is the liver. The liver kind of acts like the garbage dump. It metabolizes all these hormones when they're done and takes them out of circulation. So let's see where I went.
Thank you. Again.
Okay. So the adrenal functions in a very interesting way. This is usually where people in the society go off the rails, but not always and not exclusively. The adrenal gland makes makes a number of hormones, but 2 ones that we're concerned with today. First of which is adrenaline, and adrenaline is the when let's say if a lion kind of crawls in through the window or something, we're all going to be like our heart will start pumping, we'll kind of freeze, or then we'll run away, or if we're really brave, we'll go and like beat the crap out of it and so forth. It's that hormone. I'm going to kill you, I'm going to run away, I'm going to freeze. That kind of response. That's very quick. That lasts 30 seconds to a couple of minutes, at least in a healthy person. The second is it makes corticosteroids. So we know corticosteroids because they're given as drugs a lot, but steroids essentially, they are our long-term stress hormones. They shut down digestion, they increase our blood sugar, and then increase fat deposition and so forth. They decrease pain, and they decrease inflammation. Eventually our body loses the ability to make these steroids, and then they kind of, it's funny, all the bad effects stay, but all the good effects go away. So when our body loses the ability to make them, it runs out of the nutrients, the tissues that make them get exhausted. The anti-inflammatory effects go away, but the raising of the blood sugar issues and the shutting down of digestion kind of stays, which isn't fun. they have a very profound relationship with the ovaries, which we'll go into in a little bit. Both of those are based on steroid hormones. So steroid hormones are hormones that have a backing of cholesterol to them. So quite often, if the adrenals are pumping out cortisol, a lot of the nutrition and a lot of the substrates that would go into making things like estrogen and progesterone will be shunted over to the adrenals to fulfill that. The thyroid also, in conjunction with the adrenals, will often kind of pick up some of the slack when the adrenals are failing as well. And thyroid disorders profoundly affect the ovaries and the entire menstrual cycle. So, oops. So, PMS. So we'll start with this one. PMS is a series of symptoms that occurs regularly during menstrual cycles. Usually people get it, every time they have a cycle. I'm sure you all know all about it, but just to go over it, the main symptoms: pain, cramping, emotional changes, actual having menses that are difficult to pass and just not as well, not what they should be, water retention, and almost anything else. So there are a very large number of things that happen like that in our culture, or there are a lot of pathologies that really can coalesce in difficult menstruation. In our culture, they're usually caused by one of two things. They're usually caused by either exogenous hormones, we'll go into those a little bit, or adrenal stresses. Remember that diagram I just showed you where the adrenal glands are dealing with so much stress that they're just sucking everything away from the ovaries. So exogenous hormones are substances which resemble hormones, and they almost always resemble estrogen. Sometimes they actually are estrogen, which the body comes into contact with and throw off the body and throw off the hormonal balance. The balance of estrogen versus progesterone and the different types of estrogen and the regulation thereof is actually quite an intricately developed balance. And one of the factors and one of the things that often gets thrown off when these excessive hormones are ingested. I actually just went to a conference in the States on cosmetic acupuncture, and one of the things we did discuss was personal care products. And you would, honest to God, be surprised by the number of personal care products that include estrogen in them. I'm not going to name names. You can come up and ask me when the tape is off, and I'll tell you all you want. But yeah, no, a lot of moisturizers and so forth, especially the ones specifically marketed towards women, they contain estrogen. Plumps up the skin, makes it a little bit more firm and so forth. Kind of, sort of illegal, but not really. So, Health Canada just got the power to recall drugs that were in some way defective or contaminated or so forth. Recalling cosmetic products and moisturizers, it just doesn't really happen. And of course, adrenal issues will put further stress on the hormonal system. So in most people, it's usually a combination of the two of these things. So exogenous hormones. Another really big one is soy products. Not so much the fermented ones, but things like soy milk and edamame and so forth. Those contain an absolute buttload of estrogen. That's a funny word I just came up with, isn't it? So anyway, they contain a huge amount of estrogen, and that is absolutely, that they generally don't do. They're really bad for men, not so great for women either. So, yeah, and this is in a lot of sort of a bit more chemical ways of dealing with women's health. There's this idea of estrogen dominance, that the body simply produces too much estrogen, and so one of the big supplements is to put progesterone in. Estrogen, progesterone kind of balance off each other to overcome this. My idea is usually lower the exogenous estrogen, and then estrogen dominance becomes much less of a thing, if that makes sense. You guys have any questions?
Constant.
I don't know how I managed to do that. So this is just a little bit on cholesterol, where women's hormones come from and where they're metabolized. This guy up here, don't worry, there's not going to be a test. This guy's cholesterol. It gets metabolized down here. This is cortisone right here, up on the top right, and this is estrogen down here on the bottom right. So you see they kind of flow into the same pathways. See, this guy right here is testosterone. Women do actually have a fair amount of testosterone in their bodies as well. They just have estrogen as well. All of estrogen is made out of testosterone. So we kind of think of testosterone as a male hormone and estrogen as a female hormone, and that's just not the case. So most women do have a fair amount of testosterone. I think it's actually, that is under a lot of investigation as a target for drug development for women who just have very low sex drives and so forth. They're trying really, really hard to come up with a female Viagra, and they failed miserably, but this is one of the targets they had. So this is essentially what we're talking about when it comes to this. So I changed, sorry, I borrowed this from my men's health presentation. That should say ovaries, but the exact, very similar principle applies. They move over. All of the hormonal nutrition moves over to the adrenal glands, neglecting those. So my apologies for that. Men and women actually have different manifestations, but a lot of the roots of their specific gendered health or their specific gendered health conditions actually stem from the same source, or very similar processes are at work there. So let's see. So how do we solve this? This is actually a relatively simple thing to solve. Just plain old PMS is actually quite easy. There are three main solutions. Hormonal balancing. If there's one great strength of herbal medicine, it is hormonal balancing. Herbs have a very interesting effect. Many herbs are what we call adaptogenic. If they basically give the body a bit of a stimulus to rebalance itself. There are a number of herbs that specifically deal with women's health and women's hormones, that if there's a level of a hormone that's too high, they will lower it. But if you give that same herb to someone that has that same hormone but too low, they will raise it. They have a very interesting effect that way. Much of the difficulty in a lot of hormonal medicines and so forth is just the difficulty in testing, the difficulty in determining what is deficient, what is excess, and so forth. Hormones, specifically the steroid hormones, they don't have a constant blood level. They fluctuate throughout the day and depending on a person's cycle and depending on where in the year it is, and so forth. Using herbs really does address that because it simply gives the body a signal to re-regulate itself, to balance out its hormones, or to rebalance its hormones if it wasn't already doing so. The second thing is removal of exogenous estrogens, getting rid of soy milk, getting rid of a number of other things, getting rid of some of the cosmetic products that people are taking that are really just plumping up their skin full of estrogen. That's not healthy, and there really are very good, like there are different brands of cosmetics and moisturizers and things that don't do that. And quite often when you simply remove those exogenous sources, that's wonderful, the problems go away. There are times when you need to actually specifically detoxify that. When you need to specifically detoxify those exogenous estrogen or exogenous hormone exposures. So there's a method I use called CEASE that does that very well. So, any further questions on that? Okay. So please don't hesitate to ask. So, menses. We kind of think of them very simplistically in Western medicine. In traditional Chinese medicine, which every naturopathic doctor in, I think, Canada has to study. It's not as big in the States, but in Canada it's quite important. Menstruation is seen as kind of the end product of many organs hormonally functioning together, or many organs functioning together. And ideally in Chinese medicine, a period should be smooth, red, not pink or brown, without clots, a moderate amount, and it should be absolutely painless. There shouldn't be a symptom of mood issues or pain or cramping or anything else like that. All of those occur when one of the other organs that's contributing to menstruation is not doing its job. So that is a really complex topic in and of itself. in Chinese medicine, they have a very different way of looking at physiology, but it's when you actually start using it, it's actually quite fascinating. So three of the organs that actually really strongly contribute to menstruation are the spleen, and the spleen and the pancreas, or the spleen in Chinese medicine and the pancreas in Western medicine are kind of the same thing. The liver and the kidneys. The spleen contributes a lot of the substance to the body. It's responsible for digestion and assimilation and everything. Very, very scanty periods and so forth usually are a result of the spleen. The liver is, in addition to doing its detoxification functions, is very responsible for muscles and the contractile function. Quite often, like pains with cramping are very much associated with liver dysfunction. And the kidneys are responsible, they contain what in Chinese medicine is called jing, your reproductive essence. When that is deficient, conception just won't happen. So quite often in people who are having difficulty conceiving, you tonify the jing, you tonify the kidneys and everything else, and these happen, or conception happens. So the solution to these is fairly complex, but in short, herbs, Chinese herbs, both Western and Chinese, are very excellent for this. Acupuncture. Acupuncture is really just, I'm starting to do more and more of it. I was not doing a lot of acupuncture for a little while, and now I'm doing more and more and more of it, and I'm just like, oh, why did I ever stop this? This is wonderful. So it really works wonders for balancing hormones. Diet, of course. We're trying to rebalance those things, getting rid of exogenous estrogens and making sure that the body has adequate fuel to do what it needs to do is excellent. And homeopathy. I love homeopathy, it just works so well. Acne. So acne is actually a really interesting condition. It's often a problem of multiple different hormonal systems. And quite often that's compounded by the skin being used as a detoxification route, as well as bacterial, internal bacterial issues. So I did a talk about a year and a bit ago on the 4 ways of detoxification, and it was before I bought my little thing. So I didn't record it, and I'm probably going to re-record it and put it on my YouTube channel. Quite often when the body is unable to detoxify and metabolize its toxic burden, it will come out the skin. You'll get things like rashes and occasionally things like, if it's more severe, like cystic acne and so forth. Another problem with acne is quite often excess of testosterone or excess of other androgens. Those can occur. It's actually very similar to getting an excess of estrogens. The sources are a little bit different, but the basic mechanisms are the same. So what we do with this is we usually, acne is actually a pretty complex condition to treat sometimes, just because there's so much you need to do and there's so many things that contribute to it. So usually you need to get the digestion balanced. You need to make sure that people are detoxifying effectively and that their skin is not being used as the organ of last resort to get whatever the body needs to get out. And you need to balance the hormonal systems slightly differently than how you balance the hormonal system of someone without acne or just because of the androgen excess, but that usually is the case. Infertility. So there are 2 big things that happen today, or there are 2 big factors that go into this. I mean, how many of you have known people who have had trouble conceiving? Oh, that's almost all of you. 2 factors. Increased age of child rearing. Humans are biologically supposed to reproduce early and frequently, and we're not doing that, and yeah, we're just not, and so we haven't quite adapted as a species to reproducing in our late 20s and early 30s yet. That is a function of economics, mostly. It's really interesting because I hear a number of commentators politically writing about how family values have declined and how people are selfish and so they don't want to reproduce anymore. And I often find this really, really self-serving because many of these people are kind of responsible for creating the economic conditions that are delaying reproduction in the first place. I think people would have just as many children as they always would have if we could afford it, or if we didn't need, or if you didn't need, a graduate degree to earn what a high school graduate could have earned, 30 years ago, and so forth. I actually find that pretty self-serving and really cynical to blame people for coping in the best way they can by delaying reproduction to the economic conditions that they've really set in place 30 years ago. And I mean, maybe they're not aware of the connection between the two, but I certainly am. So that is an economic thing, and the decreased health of the population in general. We often tend to think of infertility as a women's problem, but actually statistically about 40% of the time it's men. So quite often there's a number of issues with the sperm quality or various other things that are going on in the man's life, and that can impact reproduction very heavily as well. So, oh, yay, this is a good presentation. I'm preempting myself in my slides. The big issue with men tends to be exogenous estrogens. Men are very poorly affected by estrogen. Their prostate tends to really, prostate problems are almost always an issue of exposure to exogenous estrogens, and so forth. So getting rid of those and detoxifying those often leads to a good result if it's a men's problem. Women, it tends to be a lot of other things. Men, the big thing is hormonal balance. Men need to, when you kind of correct male hormonal balance and you detoxify the exposure to estrogen, just because sperm are being continuously produced, and that's pretty much all the guy does, biologically in terms of reproduction, that tends to actually go pretty quickly. Women, just because not only conceiving a child, but carrying it to term is such a complex physiological process, there tends to be a lot more going on. So there are a ton more things that need to happen in order to ensure that your conception, or at least to maximize the chances of conception occurring. I'll talk a little bit more about detoxifying from the oral contraceptive pill. That's a really interesting topic because there's a ton of misinformation going around about the pill and coming off of it and going on of it and its effects on women and so forth. We absolutely need to address hormonal and digestive health. Hormonal, it's pretty obvious. Hormones have a very intricate role to play in conceiving and carrying a child to term. Digestive health is a little less obvious, but digestion really is the foundation of every other process in your body. If you don't have your digestion, you've got nothing. I had one patient a couple of months ago. She came in and she had chronic fatigue and muscle pain and a great deal of really, really severe other symptoms that were interfering with almost all aspects of her life. And one of the things we went over in her history was that she had all but 5 feet of her small intestine removed. Small intestine's quite a bit longer than that. So she had her small intestine removed, the vast majority of it gone. I couldn't treat her. I could have supplemented, she was having a nutrient deficiency, that was her problem. I could have given this woman oral supplementation until the cows came home and she wouldn't have absorbed any of it because she's got 5 feet of small intestine versus I think you need 20 or 30 or something like that. So I actually sent her off for intravenous vitamin therapy, and she's doing so well. I don't do that myself. I'm probably going to take the course next year, but she's doing so fantastically well now. She's she's not even my patient. She still sends people to me because she was so happy with me diagnosing that for her. Again, she didn't have digestion. She didn't have anything else. So getting your digestion addressed, very, very important. The state. The state is what I term the deeper psychological place that we're stuck. If we look at life is an ongoing developmental process where we learn one thing and then we learn another and we learn another, and there's a rough order these things come in. Quite often people get stuck in one of their developmental phases, and that stuckness will often impact the physiology quite a bit. How I address this is I will usually spend an hour or two talking with people, figure out where they're stuck, and then I'll administer a homeopathic to, in a sense, unstuck them, to get them out of that state and help them move along both in their psychological development and physically to help them out of where their body is not moving forward. So that's a whole other talk. And the last is relationship issues. This relates to the state, but this doesn't always work. I mean, how many times has a child been sought for to save the relationship, and that doesn't happen, and so forth. But quite often, it doesn't happen frequently, but quite often in men and women, if there's a deeper relationship issue, conception doesn't happen. So this is not 100% of the time. I've just seen this a few times. You address the relationship issues, get the people's states both addressed, they recommit to their relationship, and bing, a baby happens. So the hormonal detoxification is perhaps the most important one, or perhaps one of the more important ones out of all of this. Tea. So the oral contraceptive pill is almost universal in its application. I mean, it's not completely universal, but it's almost universal, particularly because people are giving it, or physicians and health providers are giving it for non-reproductive indications now. Quite often people with acne or people with hormonal problems are put on the oral contraceptive pill to balance those problems out. There's this idea that because people do have cycle, there is actual periods of bleeding when women are on the pill, that there's an actual menstrual cycle occurring. That's not true in the slightest. The pill completely stops your hormonal cycle. Like if there's, I'll just draw a picture. Oh, I hope, oh good, these are drier. All right, so let's say, you know, estrogen goes like this, and it doesn't actually, it's much more complex, and the progesterone goes like that. On the pill, everything's flat, always. The vast interplay between multiple hormonal factors is lost. What happens with the bleeding is there's 7 days of placebo that are included with the pill, and so like for those 7 days you get withdrawal bleeding. It's not the same thing as an actual menstrual cycle. It is, yeah. So it's not. It's completely different. It's just withdrawal bleeding. So there was a controversy a few years ago where there was a brand of birth control that said that they were going to stop the menstrual pill completely. And a number of people were asking me, like, Paul, what do you think of this? What do you think of this? I'm like, I don't actually have a problem with it because you're not having a menstrual cycle anyway. So what's the difference? I mean, there really probably is no difference whether there's withdrawal bleeding or whether there's no withdrawal bleeding. There's no cycle anyway. So yeah, and this can obviously be quite useful if you're, you know, using the birth control pill for like reproduction. It is a very good method of preventing conception, but that has some pretty far-reaching consequences, especially when it's being prescribed very early on for things like non-reproductive functions like PMS and acne and polycystic ovarian syndrome and so forth. So let's have a thought scenario. You are a very well-educated woman. You've got, you know, a master's and you've got an MBA, and you went and did a lot of graduate school and so forth, and meet the guy of your dreams and get married and decide at 32 that you want to have a child, and you were put on the oral contraceptive pill at 12 to control, you know, acne or so forth, and you just never went off. You are still quite young. You're still, like, all of the things concerned, or all of the things, you know, considered, you're still probably quite capable of reproduction, but you have not had a hormonal cycle for 20 years. Then you just stop the birth control pill and you expect everything to magically come back? Like, it does not work like that. Your body needs quite a lot of practice, and it needs quite a lot of help after 20 years of having its natural hormonal cycles suppressed. So, and this is, you know, leaving aside the question that we discussed earlier of overexposure to estrogens and overexposure to exogenous hormones. Yeah, that plays into it too. Quite often when people are in this situation, I ask for a good year or two before they start trying, let alone before they expect to conceive, before they start trying to conceive. I'll switch them out to another birth control method and so forth. That's far you know, easier. That's less reproductively and hormonally damaging, and so forth. And then I will start with just general detoxification, making sure their liver is able to detoxify everything, making sure that their hormonal regulation starts picking up again using herbs and acupuncture and so forth. And quite often in these cases, if, you know, we will use that cease method to do the specific detoxification of that particular oral contraceptive that they were on. And this actually is quite successful, you know, with good holistic care. Both traditional Chinese medicine and naturopathic medicine are exceedingly good at this. You can get conception actually quite well and help babies keep themselves to term and so forth. So with a minimum of medical interventions and without avoiding IVF as much as possible. I've actually seen a couple of IVF babies. I mean, that's kind of the allopathic or the conventional response to this problem is just, all right, so your body's not capable of having a kid, let's just shove all these hormones and all these eggs at once and try it. I've seen a couple babies conceived that way. They're really strange. I don't mean to say that in a bad way, but they're just, you see kids that have been conceived without IVF and kids that have been conceived with, and there's a difference. They're really spacey. I remember one of my teachers she was treated one of the early IVF babies, and she really went deep into his state. And his whole state was very spacey and just, I don't really want to be here. I didn't really plan on this, I'm just kind of here. Most of the other people she worked with had very intentional purposes for, being in their bodies and being alive and everything. This poor baby this poor kid, well, he was about 9 or 10. This poor kid was, I don't really want to be here. I'm not sure what I'm doing here. Which, if you think about it, he was literally forced into that womb and forced into life. There wasn't any, it's kind of an interesting thought pattern that way. So I try to avoid that when possible. Sometimes IVF is very necessary. Sometimes people just will not conceive otherwise, and it's a good medical intervention that way. And when that kid got his homeopathic, he turned out fine. Like he got himself out of that state, and I think he's like 18 or 19 now and is living a very good, healthy life. So that can be dealt with, but yeah. Any questions on that? I know you're all kind of looking at me puzzled. Okie dokie. PCOS. So PCOS is polycystic ovarian syndrome. It is a very fascinating hormonal disorder which is caused by, so in terms of your menstrual cycle, eggs develop. There's a little cluster of cells that will eventually create an egg, discharge an egg into the uterus where it may or may not be fertilized. Those cells develop. They discharge the egg. I'm pretty sure they don't make a noise, but they discharge the egg, and then those group of cells that remained are called a follicle, and they create hormones for a little while. If the egg is fertilized, it will create a hormonal signal that will make that follicle produce hormones for a longer period. If it's not, the follicle slowly degenerates and stops making hormones. That's how the cycle works. PCOS is when that doesn't happen. PCOS is when those follicles stick around for a while and start producing more and more hormones. And it's not like just the one stays around. They start to accumulate and they start to grow bigger, and that's when you take an ultrasound of your abdomen, they see these cysts there. That's how the cysts happen. There's a couple, interestingly enough, some of the hormones that tend to be produced tend to be a little bit different than normal. There's a lot of corticosteroids that are produced, so there tends to be issues with blood sugar regulation, as we discussed before with the adrenal glands. Blood sugars increase, and when that happens, abdominal fat increases, and there also tends to be an excess of testosterone as well. So you get things like facial hair growth in women, and sometimes it even gets profound to the sense of like baldness and so forth. Women don't naturally go bald. Balding is kind of a testosterone thing. When women go bald, that is occasionally the cause of it. It's actually really interesting. One of the people I know did a study on transgendered women who hadn't had surgery that had PCOS, and there's this really, really interesting interplay between this PCOS that they had and their gender identity and so forth, because they thought of themselves as more masculine, and oh look, they're getting hair growth and so forth, and they're getting some other masculine features. And that I read that paper that they wrote. It was really, really interesting. So many of these people did not want their PCOS treated. They wanted to stay like this. So yeah, it's a very complex illness, but there are a couple of things that really, really work well with it. Again, the same thing. I feel like a record. It's very similar strategies for each of these. Hormonal balancing. Herbal medicine does a wonderful job of just balancing people's hormones out. With PCOS, you often have to go a little bit more, you have to go quite a bit more long term until the hormones are fully balanced, until the body starts destroying those follicles. But it does work quite well. And the second thing is metabolic balancing. So getting people's metabolisms to the point where they are working again, where their blood sugar is not sky high and they're not storing a ton of fat and so forth. That is really, really wonderfully effective. So we'll get into the specific metabolic balancing plan I have in a minute, but we're just going to move on to metabolic disorders. There are a lot of them. There are many, many, many. And yeah, if you guys need to use the washroom or something, feel free. Like, I'm not going to give you the evil eye as you're going out. So quite a few metabolic disorders that occur. We're going to focus on diabetes. So just because diabetes is by far the most common one. So diabetes, there are two types. There's type 1, where the body cannot produce any insulin. This usually occurs, if you remember the older term we had for this, it was juvenile diabetes. So juvenile diabetes tends to be like this. The treatment naturopathically for this is the same as the conventional treatment, it's just insulin injections. So that's the treatment there is the same. Type 2 diabetes is quite different. So type 2 diabetes is when the body makes more and more and more and more and more insulin, it just ceases to respond to it anymore. The term physiologically is insulin insensitivity. So if you remember, insulin increases insulin makes your body senses high blood glucose, it makes insulin. Insulin makes the body move glucose receptors to the surface of the cell. They suck up the glucose, blood sugar goes down. It's a very elegant cycle until the body stops listening, until all the cells stop listening to insulin, and then the blood sugar just stays up. So the conventional treatment is a number of things, many of which I have a problem with. There's a number of agents which force the pancreas to pump out more and more insulin. This I don't agree with at all. I think most of these agents end up burning out the pancreas earlier, and then eventually your pancreas completely burns out, and then surprise, you've got type 1 and type 2 diabetes at the same time. There's also artificial insulin, which can actually be quite useful, and metformin, which is actually a diabetic treatment that I do approve of. Metformin does, it's a drug, it does increase sensitivity to insulin. So that class of drugs is actually a reasonably good one. There's also dietary treatments that are used conventionally, the vast majority of which, or it's not the vast majority, the most popular of which I really disagree with. So there's again, I'm not going to use its name, but there's a very popular American diabetes group of professionals that issues guidelines on what people should, the diet of people with diabetes. So their guideline for a really long time was that you should have 5 very smaller meals throughout the day. And we've all kind of heard this. They've been repeating it so long that it's kind of become part of our culture. They say that this will keep your blood sugar stable. It does keep your blood sugar stable, but stable and really high. It basically, I'll draw you guys a picture again. Where's my marker? Okay, here we go. So where this kind of like frequent small meals thing keeps your blood sugar here, it keeps your blood sugar at this level. So it goes up a little bit, down a little bit, and insulin as well goes up and down and up and down and up and down at quite a high level. The way things are supposed to happen, at least biologically, is you're supposed to have one meal and then a period of, your insulin, your blood sugar go up, and then you get a period of lower, not low like hypoglycemic, but lower blood sugar. And you do the same thing. So it turns out that when you do this, you have these periods of low insulin and low blood glucose, and that undoes the physiological effects of the high insulin, the high glucose. The high insulin levels really are what triggers insulin insensitivity. They trigger all the increased body fat, the metabolic disorders that that we associate with diabetes, or that gradually grow into diabetes. This does not. Having periods of lower insulin and lower blood sugar undo what happens at the higher insulin, higher blood sugar levels. Second of all to that, I mean, biologically, when you see something like this is pretty convincing to me. When two things happen in medicine or biology, like, it's convincing. Humans have a neurological reflex for peristalsis. So peristalsis is what happens when it's the action that moves food throughout our intestines. You know how long your body needs to move food completely through the intestines? 3 to 5 hours. When you eat these small, tiny little meals or snack, that reflex that moves food throughout your intestines is really not, like, it doesn't work as well. Eventually it can degenerate to the point where food is just stagnating in your intestines and they're not moving things forward they're not moving things forward at all. This is the genesis of a lot of, these ill-defined bowel conditions nowadays, like irritable bowel syndrome and, and so forth. So we've got kind of two data points here that really suggest that this is a far better method versus this. So one of the things I take almost all of my metabolism patients and all of my patients with digestive disorders off of is snacking. You have 3 meals a day. Try to make it at least 4 to 5 hours between them, and no snacking. That is really, really one of the most effective things you can do to control metabolic disorders. So there's actually a good diet on that, and there's the kind of that same diabetes association has a very carb-heavy diet. There's a really good book on diabetes by Bernstein. It's called The Bernstein Diabetes Solution. And it's not the weight loss Bernstein guy, it's a different guy. But he's got a very low carb diet. And not low carb in the sense like Atkins, but low carb in the sense that if you have like a little bit more, a little bit less carbs when you're not having that many, your blood sugar's not going to go nuts. So I really tend to favor that. So yeah, no, and of course, supplementation is really important with diabetes. Just to, like, there are some supplements that you can increase the dosage a little bit and use more than you would get in normal life, and those can really minimize the damage you would get from diabetes and various other complications. Any questions like that? Have I horrified you all with the with everything? Okay, that's good. I thought I would be freaking you all out about the birth control pill and so forth. So let's go to the next one. So one of the big things that I often find myself treating nowadays as well is the consequences of medical treatment. Usually this is conventional medical treatment. Sometimes there's a botched procedure or something done by another naturopathic doctor. 4 years of practice, I found one of those, and that it wasn't anything that they did wrong. It was this person had a really terrible reaction that I wouldn't have predicted either. So and so forth. These can have really profound effects, and they can last decades and decades and decades. And we're not only talking about major things like I had a botched surgery, or I had a surgical glove left in my abdomen or something like that. There can be just normal procedures where nothing went wrong, or normal therapeutic things like taking a drug or something where nothing went wrong can have those profound effects, and they can be often quite subtle. Let's see, I had one patient who came to me at 30, and she went under anesthesia when she was 12, and ever since then she felt she was unable to connect with people emotionally. Wasn't quite autism, but she was kind of close to it. If she was younger, she probably would have been diagnosed as Asperger's and so forth after that. And that was just after the anesthetic. She was under this specific anesthetic. I forget which one it was. But we did the detoxification. We did cease on that anesthetic. And oh my God, she can connect to people. It's like, oh my God, Paul, I love my boyfriend. Like I liked him before. He was really nice to me and everything. And we had great sex and everything. But I love my boyfriend. Like, you don't get it. I love him. Which I was really happy with that. That was one of my first cease cases. So it can be things as subtle as that. Things as subtle or as subtle as having a tendon rupture or having musculoskeletal problems after an antibiotic. There's quite a lot of that, actually. They don't tell you that, but there's quite a lot. So yeah, this is quite a big field. I could, again, talk to you for days and days and days about that. We detoxify. I use cease a lot. If we're specifically talking about antibiotics, there's a couple of ways I use of rebuilding microbial populations. I use both a series of remedies called Sanum, which if there's bacteria that are sitting on the fence, whether they're going to attack your body or be nice to it, it pushes them back to that, or pushes them back towards being nice to your body. And of course, good old standby of probiotics, giving your body healthy bacteria. Sometimes if there's physical consequences to what's, whatever medical treatment you've had, we need physical medicine. I will often refer people to a chiropractor or a massage therapist or an osteopath to get that done. And unfortunately, sometimes these conditions are unresolvable. Not so much the drug ones. The drug ones usually can be resolved quite well, but physical scars of physical scars and like botched cosmetic procedures and so forth, sometimes you just can't deal with that. But you usually can palliate them quite well. You can usually make the suffering and whatever else is going on quite a bit better. Breast health. This is another big thing, and I'm probably going to freak you all out again. Breast health is really strongly interrelated with hormonal health. So breast health is, hello. You here for the women's health talk? You can come, you don't have to be female. Oh, it's happened to me too. It's happened to me as well, so, yeah.
Oh.
Yeah. So breast health, the breast and breast tissue is really strongly correlated with the rest of the system. If there are hormonal imbalances elsewhere, they're going to show up in the breasts. It affects many women, not only with things like pain and distend and pain in general, other issues, but it can eventually become quite severe. Breast tenderness is one of those things that anthropologically does not show up in hunter-gatherers. Hunter-gatherers, and there's this really interesting book called Nisa, I think it was by Marjorie Shostak, and it was this group of hunter-gatherers who lived in the Kalahari, and so they would have these little anthropologists who were Westerners come up and talk to them, and they would talk to these hunter-gatherer, or they would talk to these hunter-gatherer women, and they would chat about, well, I'm having my period now, like, aren't your breasts tender? Don't you want to kill everyone? Aren't you really like having a hard time? And they're like, no, I'm having my period. And as these women got older together, they would talk about menopause, like, oh my God, isn't it really dry down there? Don't you want to not have sex? Don't you want to kill everyone around you? And aren't you getting like hot flashes and things like that? And the Kalahari women are just like, no, I just stopped having my period one day. Those kinds of problems really are specific to our culture. And again, breast health is often another one. Breast cancer in a lot of other cultures does not happen. There are various health mechanisms that our body has to reduce these things and to deal with health, and to maintain health that aren't present in our culture. So, yeah, and unfortunately, in terms of therapeutics, there's very, very little available conventionally on this. There's a lot available naturopathically, and we'll talk about that. But first and foremost, the first step to this is always hormonal balancing. When you get the hormones balanced, a lot of this resolves. This is the term that we're all terrified of. My dad, before he strangely enough died of cancer, would always call it cancer. It's it's something that we're all quite terrified of. I admit it, I do a cancer prevention protocol. Part of the reason is I'm really scared of going that way. I don't want to do that. But breast cancer is actually one of the better cancers to get because it is actually one of the rare successes of cancer treatment. It's one of the very few that has seen improvement over the last couple of decades. If you look statistically at cancer and cancer survival times over the last 20 or 30 years, if you factor out early diagnosis, the mean survival rate for cancer has improved by, I think it was between 1% and 3%. So the mean amount of time you live with cancer is improved by that much if you factor out increased early diagnosis. I know it's a sobering thought. We're kind of told all the time how people are living with cancer and how they're living longer with cancer. And there's been a couple of really good success stories, one of which is acute lymphocytic leukemia. One of which is acute lymphocytic leukemia with children, and the other of which is some kinds of breast cancer and so forth. But those statistics are kind of a little bit misleading because they're saying people are living longer when they're being diagnosed earlier, and you kind of can't do that. That's not okay. People are still dying at approximately the same amount at the same point in their disease for the vast majority of cancers. That kind of 1 to 3% improvement in survival time is not evenly distributed. So some cancers, actually most, it's exactly the same. Some cancers, it's gotten quite a bit better. So breast cancer is one of them. Some kinds of colon cancer too, as well as childhood leukemias. So one of the issues that has come up, however, with breast cancer is screening. So we're often told about preventative medicine, how preventative medicine is the wave of the future and so forth. And one of the success stories that's trotted out is mammography. Mammography is not preventative medicine. Mammography is early diagnosis. Preventative medicine is medical treatment that will stop something from happening. Early treatment is getting something before it gets out of control. Big difference there. Mammography is just screening for cancers before they happen. It does not reduce your risk for cancer, and it kind of increases your risk for cancer. It's one of those tragic statistical facts that mammography, the radiation exposure from mammography does increase your risk of cancer. And yeah, furthermore, a lot of lesions are diagnosed with mammography aren't actually going to develop into full-blown cancers. Your immune system will take care of them one day, but you see them on mammography and it's like, oh my god, we need to get rid of it. And then a surgery happens that may or may not be necessary. I really hesitate to think whether or not that kind of overdiagnosis is really responsible for an overdiagnosis and overtreatment of lesions that aren't going to do anything is responsible for the improvement in breast cancer statistics. It may be that that's kind of that the improvement in breast cancer statistics that I just mentioned is an artifact of that overdiagnosis and overtreatment, but that's like I don't know how to determine that. So mammography is still good, however, and it is still worthwhile if there is an actual lesion. If you're doing a breast self-exam, or your naturopathic doctor or your physician is doing an exam, and you find like, oh, look at that, there's a lump there. Still good, still worthwhile, still a good diagnostic tool. So, but yeah, no. So I know a few of you have probably read in the news how they're sort of de-emphasizing mammography and how screening mammography is being, not recommended any longer. Has anyone heard that? Oh, well, it is. The gold standard right now is that does not appear to increase cancer risk, at least so far as we've seen, is a breast MRI. It's actually quite a bit better. Good luck getting one. Can't get an MRI for things that are important now, let alone a breast MRI. So, yeah. So that's unfortunately it. That kind of puts people, like the main screening tool for this condition has been is being removed because it does actually increase cancer risk. The replacement is just not available. What happens? Oh yeah, there's my black humor. Is the solution just waiting and praying? We totally can do that, but there are actually others. General naturopathic care and naturopathic cancer preventative care, I think, is an excellent option. And we know this because there's another type of breast screening technology that does not appear to increase cancer risk, but does appear to be correlated with breast health. So, and of course, addressing your hormonal stuff before this happens, or before any kind of cancer develops, will decrease your risk of cancer. So, breast thermography. Breast thermography is very interesting. Whoever thought of this is like a bloody genius. So, cancer cells, in order to nourish themselves, will create new blood vessels. So if there's like a tumor, it will have to create new blood vessels. Otherwise, it will just starve to death from lack of oxygen and lack of nutrients. These new blood vessels are different than regular blood vessels. Regular blood vessels, when, like if you put your hand in cold water, all of the regular blood vessels in your body would just like, they would scrunch up and there would be less heat everywhere. Cancer blood vessels don't do this. So what basically thermography is you have a picture, you go shirt off, bra off, you go in front of this camera, they take a picture of your breast normally, you put your hands in cold water for a period of time, then you take a picture afterwards and you compare the before and after. The normal blood vessels will get colder. The not normal blood vessels, the cancerous blood vessels, will expand. It's really interesting, and it's not just like you have cancer, you have to, there are gradations. Just like were any of you here for my cancer talk? So if you Google Paul Terrio Naturopathic and just take my card and so forth, because my name is hard to spell, and make sure you put in naturopathic, because apparently there's this Paul Terrio in Spain who's this really interesting sportscaster, and he's really enthusiastic and excited. If you Google that, one of my talks is I talk about cancer and cancer development. Cancer doesn't just magically appear in your body. It is a series of steps that you can prevent. Like you can stop the body from taking the next step and move it back if cancer is kind of developing. So it shows these developing blood vessel cells, and it shows them in stages. So yes, I'm going to show you some pictures. So here's one. So here we can see the whiter areas are kind of the areas that are hotter, and this is so after the thermogram and so forth. So we can see here, these areas are fine, these areas are fine, they're cooler. These white ones are ones that we have to be a little bit concerned about. I think this is a really good screening tool. Health Canada came out a couple of years ago, and I came out against the use of thermography for breast cancer screening. I disagree with Health Canada on that. The Canadian Association of Naturopathic Doctors came up with a position statement that, according to the research, the published research and the clinical trials and so forth, it is actually a good tool, and Health Canada just doesn't seem to be acknowledging that. So we don't do breast cancer screening with it. We do breast health screening, and the consensus within the profession is by using this tool and doing things that help reduce the scores here, we can reduce the risk of breast cancer. So just for legal purposes, we do breast health screening with it. But yeah, no. So if you go online and look up the CAND position paper on breast thermography, they have a really good position paper summarizing the research on it.
So finding these and stuff, would you be recommending like the herbs and stuff to try to?
Oh, here, we got another picture.
Okay.
We also use thermography to monitor. So in this one, this is just kind of a different camera. So red and white means really hot. So that means the cells aren't contracting there, which means there's probable cancerous activity going on there. This is after treatment. Where did it go? It's gone. So this is actually, I find this a far more effective tool because you can see the changes. You can see that they're like, oh my God, hot spot, come in, and this is a year later. So, and if I send you guys this or I put this on the internet, I can't put this photo on, so just remember it now, because this is not my photo. I just can't do things that aren't mine. I can show them to you, but I can't put them on the internet and claim them as mine. But we see here, there's quite a big improvement. So you go and you do the thermography, you see that there are some lesions, you proceed with treatment, reevaluate a year later, and poof, there's improvements.
What is treatment? What do you mean when you say treatment?
Again, hormonal. I would actually, with a case like that, I would probably do my cancer prevention protocol, which is, I've got a video on it and so forth, so I'll ask me again at the end and I'll explain that cancer prevention protocol to you. I would do the hormonal balancing. I would adjust people's diet, get them on a good homeopathic. all of the basic naturopathic things. As well, there's specific things you can do, like physical medicines to help the breast drain, and fashion things as well. Like there's certain types of bras that, like I haven't done as much research into this as one of my teachers, but certain types of bras that prevent, like especially with the underwire, prevent lymphatic drainage of the breasts. Those really create stagnation, and that's not so great. So there's other types, which I can't recall off the top of my head, but you know, if anyone comes in, I will get that information for you, where that's not an issue. So, as well as other basic, you know, things like that. So, general, like much of naturopathic treatment is actually very similar. You're creating the environment for health. You're stimulating the body to correct itself. You're tonifying and you're helping any organs that aren't performing that well. And you're addressing structural integrity with the musculoskeletal system and so forth. So a lot of naturopathic medicine is actually very similar to each other. They're just little bits and adds-on that are specific for each condition. Right, you guys understand now? You're less freaked out? Hooray, because there are solutions to this, even if mammography for screening purposes isn't one. Women's cancers. I'm not going to go into this in great detail, but there are several major types in addition to the cancers that men and women share about equally, like lung cancer and skin cancer is about equal. So there's the big one that's actually quite interesting right now is cervical cancer. It's usually, and this is like the one example that I'm aware of where allopathic medicine acknowledges there's a stage of progression. Like everywhere else, it's kind of like, oh, cancer just magically happens. In cervical cancer, they're very clear because it's easy to observe. It's like, all right, so this happens, and this happens, and this happens, and then cancer. And they try really hard to move you back through there. It's usually caused by infection with various human papillomaviruses. There's a vaccine out there, seems to prevent human papillomavirus infection, but whether it prevents actual cervical cancer, I don't think they've studied it for that long yet. It should. But cervical cancer is really screened for. It's easily screened for, and it's treated early. And this is again one of those few cancer success stories. It's like cervical cancer and the complications from that have gone down quite a bit because of this. And this is actually preventative medicine. So I commend conventional medicine for the cervical cancer thing. They've done a good job there. Both naturopathic and allopathic therapies work quite well here. Allopathic therapies, they often do cryo treatment and so forth, so they'll just freeze the actual lesions off. That works quite well. Naturopathic treatment, they'll use back in the day when naturopathic doctors treated, tons of cancer by themselves, one of the herbs that they used was sanguinaria, and so they will paint sanguinaria on the inside of the cervix, and it does a very similar thing. It takes the surface layers off, and sanguinaria does have some good anti-cancer properties to it that seem to promote the body's ability to heal itself. I don't do that. I refer to people who do. That's called an escheriiotic treatment. It's just a level of expertise that I don't have, so I refer for that one. But yeah, no. But the big thing, pap smears. So totally important, especially if you're sexually active and not in a monogamous relationship, which that does happen.
So my doctor, I used to get one every year, and then it changed to go every 3 years or something.
Yeah, that's fine.
Okay.
Yeah, that's fine. You don't need one every year. Those guidelines are actually pretty good. You don't need one every year, every 3, because again, cancer doesn't magically happen. So it does take a while to progress. Yeah. So
I was just surprised when she had said, "Oh, you don't need it now."
Medicine historically goes in several phases. There's an ambitious phase where they try to treat everything and without even really thinking about it, and then there's a phase when that's pruned back. Historically, I call it the phase of medical exuberance and the phase of medical nihilism. We're in a phase of medical nihilism now where we're looking at how effective everything is, and turns out a lot of the stuff is not needed as often or is as effective as we think it is. So we're in kind of a phase of medical nihilism. And it's very interesting because historically, whenever medical nihilism happens, conventional medicine will adopt whatever naturopathic doctors or their historical precedents or their historical, forefathers and foremothers have been doing. So now we've been doing nutrition and drainage and things like, nutritional medicine for a very long time. And now in this era of medical nihilism, when we're finding out a lot of the treatments we're doing don't work, they're picking that up. So it's very funny. Historically, this is the last time it happened was in the 1800s when it was homeopathy that was kind of the big thing then. And so they picked up a lot of the treatment principles from homeopathy, like the smaller doses and the more precise testing of remedies and testing remedies on healthy people and healthy animals and so forth. Those all originated within homeopathy. That wasn't some medical advance that they stumbled upon. They kind of took those, and then homeopathy died out. And that was during a period of medical nihilism that was happening in the mid to late 1800s. Nowadays we're going through one, and they're taking all the lifestyle medicine. They're kind of adopting all the lifestyle medicine. So, yeah. Ovarian cancer. Ovarian cancer is actually a lot more difficult to diagnose, especially there's no early screening tools for it, and there aren't really good symptoms. It just kind of looks like vague abdominal discomfort until you have cancer, like until severe things happen. Yeah, that's unfortunately one of the things we don't really have good access to yet. I do suggest like just general cancer preventative things and hormonal balancing issues. I would suspect, I don't have proof of this, but I suspect that ovarian cancer proceeds in the way that cervical cancer and most cancers do. There's phases of tissue degeneration that happen until the cancerous threshold is reached. And again, if you look at my cancer prevention video, I go into that in quite great detail. So the phases of cancer, you can stop it and move things back. And I suspect my protocol does that. I don't have the data on it yet, but based on the research I've done, this is what I think happens. So we're not going to go into that one too much. Oh wow, hooray for me, preempting myself again. So I do a yearly cancer preventative program. It involves some injective therapies, some supplements, homeopathics, and I'm probably going to involve ketogenic fasting. So a lot of you have heard of the Atkins diet, which is the big thing about a decade ago. Yeah, so Atkins diet, actually okay for weight loss. Not great for keeping it off, but okay for weight loss. One of the good things about it is that ketogenesis. Cancer cells lose the ability to metabolize anything that's not sugar. So if your body is running on ketones aren't sugar, cancer cells starve. There's a little bit more training that I need to do before I go into this, or before I start people on ketogenic fasting and so forth. So it's probably not going to happen this year, but next year. But yeah, I will probably start involving people when they're doing on my future editions of my cancer preventative protocol. In addition to all the stuff that I'm doing, like basically this stuff, so these 2 lines, I do already, this is coming. So probably not this, like I do it every January, so it's probably not this year, but next year I'll be doing the ketogenic fasting and so forth, just to add in another dimension to this preventative protocol. So I'll probably just be doing fasting for a week, and not even really fasting, but just, the thing with ketogenesis is your body makes ketones out of fat in order to metabolize them. So we're going to eat fat for a week. We're going to live off of like cream and butter and stuff. It's going to be awesome. So, okay, one of my last medical topics, urinary tract infections. They're very common in women for several reasons. Women have a shorter urethra, so urethra is the tube that goes from the bladder to the outside. Men, it's actually pretty long. So bacteria have a long way to travel before they get to the bladder and so forth. And yeah, with women, pretty short. So that's just an anatomical reason. Another thing that happens is quite often the untreated consequences of sexually transmitted infections. Sexually transmitted infections are really, really common. I think that there's ones that aren't culturable, but I had one going around some of my gay patients a little while ago. It was just lymphatic swelling throughout the body, and I was like, most of them had unprotected sex right before, and I went and sent them off to Sheldon Schumer to get STD cultured, and nothing came back. I was like, oh, did I just discover a new disease? Because I don't think I want to do that. But it did get better with treatment and so forth. And so far they're doing all right. But yeah, no. So that's kind of interesting with that. So women, and many STDs in women are actually a little bit more difficult to diagnose as well. If there's not the characteristic symptoms of discharge and pain and so forth, and you're not getting regularly tested, how do you know? Another issue is probably decreased immunity in modern life, and I've talked a lot about this. You know what the biggest thing that really decreases immunity in life is? Sugar. Sugar switches off your immune system by 80-90% for about 4 hours. And think about how we eat in this society. We have like sugar with breakfast, and then we have sugar with lunch, and we have sugar with dessert for dinner. And then if we have a snack, we're gonna have sugar with this. We're basically like covering our bases so that our immune system is functioning really terribly almost all the time. So yeah, sugar should happen. It's funny. Sugar should happen once a week. Like that's how often I try to have sugar. And there are exceptions, like Christmas is coming up, and I'm gonna have sugar during that. I love like having a box of chocolates and so forth with my family and things like that. And we're going out to Stage West because I take my family to a show every year. So we're going there, and I'm gonna have dessert. So it's not the end of the world if you do, but sugar should happen once a week. Always, no exceptions. I say that knowing exceptions are going to happen, but yeah. And the last of which, I think a lot of urinary tract infection, there's this idea within naturopathic medicine, and I found it to be true as well, that a lot of acute infections are in fact the body detoxifying something. I've seen it quite a lot. I know people have a great toxicity in their brain. I give them homeopathic, and then all of a sudden it's like a drain opens up and their sinuses go crazy. And not just like sinusitis, but like it's like a waterfall or something. I suspect it may be a similar mechanism with the body. This doesn't mean we don't want to deal with this. The urinary tract is not the best way to detoxify, but yeah, and there can be consequences of that. So we want to deal with this, but that's one possible hypothesis about this. So if there are chronic STIs, antibiotics work well if there's an actual active infection. If the infection has been dealt with, but there's still consequences, homeopathy is fantastic for that. It works really beautifully for that. You can get rid. I think my record for getting rid of something like that is about 40 or 50 years. It was in an older patient, and chronic symptoms of like joint pain and so forth, which is really typical of gonorrheal infection. And then, did you ever have gonorrhea? Yeah, but I had it treated with antibiotics. I'm like, when did your urinary pain, or when did your rheumatism start? It was about the same time. So often gave her a treatment of that way, and worked really well. Decreased immunity can be addressed with hormonal issues like balancing out your adrenals, routine, and of course, I said this, avoiding sugar. And if these infections are a detox mechanism, homeopathic management can be effective, and we can also train your body into more efficient ways of detoxing, like through the bowels and so forth. And of course, microbial rebalancing. Everyone who's on antibiotics needs to rebalance their microbia. Antibiotics kill your good bacteria and your bad bacteria, and you need to address both. You need to repopulate your good bacteria so nasty things don't happen. Oh, okay. So that is the last of the health things. Does anyone have any questions for me?
I'm just kind of wondering if the last statement that you just made there.
Yeah.
So, are you suggesting that you would go to a homeopathic person after you have antibiotics?
Yes, I would. My teacher, Michael Adams, who's a naturopathic doctor as well, he thinks that people should be on probiotics for a year after they take antibiotics. I usually do a month. So I've got one patient who's got some pretty extensive surgical procedures and goes in every couple of months to get IV antibiotics because he gets a really bad infection, and I give him the strongest probiotics I know. Most probiotics on the market have a couple 100 million. Maybe if they're a good brand, you get 1 to 2, maybe up to 5 billion. The magic number for repopulating the entire gastrointestinal tract is 30 billion. 30 billion, what are called CFUs, so colony forming units per capsule. I give him 100 billion for weeks, just because this person gets really bad C. difficile if he doesn't get that. So C. difficile is it's a bacteria that's not really killed by most antibiotics, and it lives in everybody. But when you kill all the other bacteria, it starts to multiply and gives you really bad diarrhea. Like, any of you have nurse friends? Ask them about C. diff. Just, it's the bane of everyone's life.
So there's ways of doing like your probiotics naturally too, right?
Yeah, fermented vegetables.
Yeah.
I recommend those. I recommend those for day-to-day use. So if you're just, I think most people should take like a little bit of fermented veggies every day. You can make those yourself.
Yes.
Like kimchi and like sauerkraut, non-pasteurized.
Yes.
They have to be non-pasteurized, and you can make those yourself.
Are there any of them that taste good?
Yes.
Sauerkraut's good?
Yes.
It's not.
There are some. Like there's one I make that's made out of fermented carrots and ginger that I really like. And there's some sweet ones and so forth that you make out of fruit and so forth. So there's a really good book called Nourishing Traditions by Sally Fallon. I don't recommend people to take probiotics every day, but I do recommend that they take fermented vegetables every day. I do recommend, like, there's times when you just need probiotics, like after antibiotics. That is when you need them.
Who is it by again?
Sally
Yeah.
Fallon, Fallon.
How about the yogurt?
Some people can't deal with milk. Yogurt actually has a pretty low number of probiotics, and yeah, but generally yogurt's an all right one. I recommend fermented veggies above yogurt, but yogurt's not bad. Anyone else? Yeah. Just remember that number too. If you're taking probiotics, and I know some of you are going to do this without seeing a naturopathic doctor, and fine. 30 billion is the magic number, and I'm not giving you medical advice, but this is the number of bacteria that is needed for anyone to repopulate the digestive tract. 30 billion, that's the number. 30 billion CFU. All right, so indulge me for a little bit. I just went and did this in a seminar, and it's so super awesome. So I went down to San Francisco to learn cosmetic acupuncture. So it's the use of acupuncture. So I learned cosmetic acupuncture before, and before I was using it I was using kind of like Botox. The reason why people get wrinkles and so forth is that their facial muscles quite often will contract. The face is the place where just facial muscles stay contracted for a while. So I was using needles. Well, the way Botox works, they inject you with a toxin that paralyzes those muscles, and then they relax, and then your kind of face moves up. Your face, de-wrinkles a little bit, which is lovely. They've done a lot of studies on Botox, however, and it seems that the way we move our faces is really intimately related to the way we cognate. Like, the divorce rate after Botox goes like way, way up. That's true. People just can't, they not only can't express, but they can't process emotion in the same way. And we know this furthermore because there's a guy there's an MD in California or something who will treat depressed people by Botoxing all the muscles that make them frown. And it sounds stupid, but they actually do get better. So by changing the way we kind of move our faces, it changes the way we process that. Acupuncture is different because acupuncture, you just use a needle, prick the muscle, it like tenses and then relaxes, and that's it. No paralysis, you can still express, you're not an emotionless zombie. And yeah, I think that's quite a good method. So that was the method I was using before. This new course, you actually put a fair number of needles in the face, and you induce inflammation in the whole face, and it actually destroys the collagen matrix and resynthesizes it. It takes about 4 weeks of twice weekly treatments to do this, but it's really super awesome. So I was really excited because I know these two methods, and so now I've got 2 ways of addressing facial aging. I can do the muscles and I can do the skin and so forth. So usually it takes off 5 to 10 years without surgery, and whenever I do this with people, I give them body acupuncture treatments. So body acupuncture balances out the rest of your body as well. So all this stuff we were talking about, the hormonal balancing, the digestive balancing, that can all be added to with body acupuncture. So yeah, and now I have pictures. I hope to God that they show up. So this is, again, these are not my pictures, they're from my teacher, Martha Lucas. So, and I'm not going to show them on the video and so forth, but these are the photos just off of her website. So this is, again, twice a week for 5 weeks. So before and after. Can you guys see that? Okay. And again, so here's another, this one's not as clear. You need to come up. If you need to come up and see them on the screen, they're much clearer up here. This one's not as clear. And this one, actually no, that one's pretty good. See this this labionasal fold or nasolabial fold here is actually quite a bit clearer. And so is this kind of wrinkle over here. So that's what I do. I just learned how to do that. I really like it. Oh, and here's another one. See that there's actually quite a nice increase in tone in the skin, and it's like happier. So I know I got it too. I got this, we did this on each other, and I was just like, oh my God, I feel so awesome. I feel so pretty today. So yeah. So anyway, we're almost, so if you guys have any questions on that, ask me. I've also got some, like, take a look at these little books here, and there's some handouts and things there. I don't have literature on that yet because I just got back from my course Wednesday or Thursday or something, who remembers. So I know it was Wednesday. It was Wednesday that I got back, so I haven't printed them out yet. But if you guys email me, I will send you off all the stuff that you need about that. So, conclusions. We didn't even cover all of them, but there's a lot of things that can go wrong with women. But there are solutions. There are both corrective solutions and preventative solutions. And not preventative by meaning diagnosing you when you're sick earlier, but actually we're going to stop you from getting sick. Yes. And those can happen, and yes. Questions?
Do you think that acupuncture could relieve the muscle cramping that happens during biologics?
Yes. Yes. Acupuncture, there's two ways of using acupuncture for musculoskeletal pain. First of which is directly. It's like, oh, muscle, needle, 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 needle. I actually brought my book on that because I'm doing that a lot more now. Yes, it does that. It also balances hormones quite well. So acupuncture does both of those things. So yes, it works very well on just relieving muscle cramping and so forth and various menstrual signs. One of the at the cosmetic acupuncture seminar I just did, one of them was this abdominal acupuncture protocol, which was super fun. When I got it, I'm like, oh my God, I didn't even have intestinal problems, but I feel super awesome. And it works really well for infertility and digestive problems and menstrual problems as well. So, yeah.
Usually people come to you saying, I don't feel well, or there's an issue. Is there, you can go into like a naturopath office and just do an all-around examination, even if you don't feel funny?
Yep. Yes, you can. So there's actually, quite often when people say that they don't have any problems, sometimes they just don't even realize that things are problems. I've never met a person who's completely healthy yet. Even the people who physically have nothing wrong with them will often have like a mental and emotional thing that's really bothering them or something. I actually have a number of MDs who come and see me who are perfectly happy, who are perfectly healthy, but they're like, oh, Paul, this is bothering me. And whatever's bothering them is reflective of their state. It's reflective of that developmental space that they're not moving through right now. So yes, and short answer to your question, yes, NDs do a lot of like health maintenance and a lot of preventative health and so forth. I just got a book on that. This book here, a lot of these are really subtle signs that just indicate a nutritional deficiency. So it's really fun. So
I have one more question to you. What about fatigue? I know a lot of people go to naturopath for fatigue. Like, what would you?
Fatigue is a lot of things. Fatigue is often adrenals.
Is what, sorry?
Adrenals. So remember we talked about the adrenals earlier. Quite often when the adrenals kind of start to not work so well, fatigue is the first thing that happens. Fatigue can often be just really excessive toxicity in people who don't have the ability to get rid of it. Fatigue can often be chronic infection, and one that I'm seeing a lot nowadays, and I know they don't say it's in we just kind of found out it's in Alberta, but I'm finding Lyme actually quite a bit. So people respond to, like, when it's just, we know their thyroid isn't working, their adrenals are working, like, what is wrong with you? We'll do a Lyme treatment, it's like, oh my God, it's a miracle. So quite often infections as well are quite often the issue too. So it depends on what it is, but almost all of them respond very well to naturopathic medicine.
What if, so you have the thing, oral contraceptives.
Yeah.
But what if you're IUD?
IUD is not, I'm not going to say this, very few IUDs are hormonal.
So mine is hormonal. What's the
Birth
difference
control
in
pills,
what it does?
Depo-Provera and the injections,
Yeah.
and the ring, but the ring is
Yeah.
not as bad because the ring is not
What
nearly
about the
as.
Mirena?
What?
Mirena,
Mirena?
which is the hormonal. It's
Is
a
that the
hormonal
copper one?
IUD. No.
It's an IUD that basically replaces the birth control.
If it's an IUD, some IUDs have a hormonal component to them. I don't know about Mirena specifically, but if it's an IUD, more likely than not, it's not hormonal. IUDs basically function, and we don't really know, but it's suspected that they function by irritating the internal lining of the uterus so that implantation doesn't occur.
So Mirena is actually a hormonal.
Oh, it is a
IUD.
hormone? Then.
It's like the ring, but it's an IUD. It's
Okay. Oh, okay. Thank you. I didn't know that. So, if that's the case, it's probably not as bad. Local applications of hormones tend to be spread less far. It's probably not as bad, but there's probably still some consequences to it. Yeah. Does that make sense? Yeah. So, forgive me. I didn't know about that brand name yet. So, as I said, some IUDs now do have hormones now. So, yeah. Anyone else? All right, well, thank you all so much for coming and being such a lovely audience. And I do so like coming and talking to you guys at AER. And thank you all for coming out and seeing me. And I hope you all have a nice time. And please feel free to take a look at the stuff I brought, or come and ask me some private questions if you don't want yourself on the internet. So, all right, bye. Thank you.